So it's not what I recommend. Believe it or not, there's a group of people called the American Society for Colposcopists and Cervical Pathologists. And so that's a group of people that all they care about is the cervix. And that's all they think about, and that's all they talk about. And they get together as a group every 5 to 7 years and issue international guidelines. And so it's one where it's not what Dr. Hancock thinks is the right thing to do, it's what the ASCCP thinks. And so between ages 21 to 30, typically it's a pap smear once every 3 years. Once you turn 30, we're going to do a pap smear, but also HPV testing, or testing for human papillomavirus. There are several strains that are significantly associated with cervical cancer. If you test negative for HPV and your pap smear is normal, then you only need one once every 5 years. That doesn't mean you shouldn't come in on a regular basis. We do still look at your cervix to make sure it looks normal. We talk with you about a variety of different things in terms of birth control, breast cancer screening, bladder function, sex, discharge, a variety of different issues, but it is one where you don't need a pap smear every year anymore, and that's a huge shift. I get asked that a lot, and it can be upsetting for certain patients. We're never going to refuse to do a pap smear, but at the same time it's important to know that medically you don't necessarily need one every year.